Hey everyone, Dr. D here, and in this video we are covering Chapter 24 from Talaro's Foundations in Microbiology 12th edition by Barry Chess. Let's go ahead and get started.
Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. Explain stuff.
All right, welcome back for Chapter 24. Now we're talking about viruses that infect humans. Specifically, Chapter 24 is about the DNA viruses. These are the viruses that have a DNA genome. Remember that viruses are the smallest parasites with the simplest biological structure. They are not alive. Remember, viruses consist of a nucleocapsid, which means some kind of nucleic acid genome, either a DNA genome or an RNA genome, surrounded by a protein coat called a capsid. Together, the nucleic acid plus the capsid is called the nucleocapsid. And there could be some additional structures to a virus as well, but it is far, far, far simpler than a cell, and usually much, much, much smaller than any kind of cell. Even prokaryotic cells are much bigger than most viruses. And remember, viruses are obligate parasites. They must infect a host cell in order to reproduce. Once it enters that cell, it instructs that cell's genetic and molecular machinery to produce and release new virion. All of the DNA viruses, which we're going to cover in this chapter, are double-stranded except for parvoviruses, which actually have single-stranded DNA genomes. In the next chapter, we're going to cover RNA viruses. All RNA viruses are single-stranded except for double-strand RNA reoviruses. One thing you should realize about viruses is that viruses are limited to a particular host or cell type. Some viruses only infect humans. Some viruses can infect mammals. Some viruses only infect primates. Not only that, but the virus can also be tissue specific. So for instance, hepatitis C only infects the liver cells of humans. Most of the DNA viruses bud off from the nucleus because the DNA viruses replicate their DNA inside of the nucleus. RNA viruses replicate their RNA in the cytoplasm. And as you probably know, viral infections range from asymptomatic to mild to life-threatening. Depending on the virus, it might be strictly human to human. It could be a zoonosis spread by animals, or even transmitted by those vectors we talked about, like arthropods. Many of these viral infections have a rapid course. This is known as the lytic cycle. However, some of these viruses can form long-term persistent infections that may last years or even a lifetime. There are two types of these persistent infections: chronic infections and latent infections. With chronic infections, the virus is always detectable in tissue, but it multiplies at slow rates, and the symptoms are mild or absent. In a latent infection, after a lytic cycle, the virus enters a dormant phase. So you're not going to be able to detect the virus in tissue samples during this dormant phase, but it can reactivate and result in a recurrent infection when it does reactivate. This image shows us an overview of the possible effects of viral infections on animal cells. So here is an animal cell that's penetrated by a virus, and you can see that one of the outcomes is those cells can become transformed. And when someone says a transformed cell, they're referring to cancerous cell. These cells can transform to malignancy. They can transform to cancerous cells, and that is one potential outcome of a viral infection. Another potential outcome of a viral infection is that chronic infection. Remember I said That's a persistent type of infection where you're constantly shedding virus at a low rate, or this can result in a latent infection, which is a dormant state that can reactivate. This is the most typical effect, is when the virus results in viral multiplication and a lytic infection. That lytic infection destroys the cells, and the cells release. There are two ways by which cells release, either by completely lysing the cell or by budding. At the bottom here, you can see lysing, where the cell breaks open and these naked virion pour out. And on the right here, where my mouse is, you can see this is known as budding, where the virus kind of does this exocytosis and buds out of the cell, taking a piece of the host membrane with it. You see this? That blue swiggle? That's part of the host membrane. And the virus can bud out of the cell and take that host membrane with it. And that's known as an enveloped virus, a virus that has an envelope. The reason it has an envelope is because it stole it from the host. So typically, if upon release, if the cell is broken open, that results in naked virion that don't have an envelope. However, if the virion bud or exocytose out of the cell, that usually results in a enveloped virion, a virus that has a membrane surrounding its nucleocapsid core. And again, during these animal viral diseases, some can be persistent, some can be oncogenic, which means cancer causing, resulting in those transformed malignant cancer cells. Several viruses can cross the placenta. So for instance, if you've ever heard of Zika virus, is known for crossing the placenta and causing developmental disturbances and permanent defects in the fetus. When diagnosing viral infections properly, it's important to look at the symptoms, the signs. It's important to isolate in cell or animal culture. It's important to do serological tests for antibodies and some tests for antigens as well. It all depends on the particular viral infection. They have telltale signs and symptoms, and they have different mechanisms for diagnosis. And so we are going to take a survey of DNA viruses. Chapter 25 is going to be all about the RNA viruses. And these animal viruses are categorized according to their nucleic acid genome. Some viruses have a DNA genome that's covered in this chapter. Some viruses have an RNA genome that's covered in the next chapter. Viruses have a capsid, and the capsid could look different for different viruses. Some viruses have an envelope and some lack an envelope. Remember, they have an envelope if they budded or exocytosed out of the previous host cell, and they lack an envelope if they lysed the previous host cell. That's known as a naked virus because it doesn't have an envelope. So we are going to cover, again, some DNA viruses that cause human disease, the enveloped DNA viruses, non-enveloped DNA viruses, and then finally, the non-enveloped single-strand DNA viruses. And here you can see some of those viruses we are going to touch on. Some are enveloped double-stranded genome, some are non-enveloped double-stranded genome, and there's only one that has a single-stranded non-enveloped genome, and that's the Parvovirus. So why not start with the enveloped double-strand DNA viruses, the Poxviruses? These Poxviruses produce eruptive skin pustules, or pox, that leave scars. These are the largest and most complex of the animal viruses. They are physically large. They also have the largest genome of all viruses inside of what looks like a nucleus, this nucleus-like core. Obviously, it's not a real nucleus, but it's a nucleus-like looking core. Though they lack the usual nucleocapsid found in other viruses. So it's really strange because they lack a proper capsid surrounding that double-strand DNA. And these pox viruses, they have a specificity, a host specificity for a particular tissue. They are specific for epidermal cells and subcutaneous connective tissue cells. Here you can see a drawing of one of these pox viruses. Look how large it is. You would almost mistake it for a cell because it's so complex and large, but it is not a cell. It is not alive. I want you to remember that viruses are not alive. They are small infectious agents. You don't characterize them as living or dead. Instead, you characterize them as active or inactive. Here you can see that nucleus-like structure containing the double-strand DNA, but obviously this isn't an actual nucleus. Notice the absence of a proper capsid protein coat. And then notice the envelope. This is an enveloped pox virus. And here it is on the right here. You can see the lateral bodies, the lateral bodies on the side. You can see the envelope. You can see the DNA inside as well through electron microscopy. And probably the most interesting pox virus is smallpox virus. It was the first disease to be completely eliminated by vaccination. It was spread through inhalation or skin contact. It resulted in fever, malaise, prostration, and a rash. Prostration is a state of weakness or exhaustion. There were two strains of smallpox, Variola major, which was highly virulent and caused toxemia, that means toxins in the blood, toxic shock, and intravascular coagulation, that means clumping of your blood. Variola minor was a strain that was less virulent. Here you can see the effects of smallpox. The newer pox appear on the face, and you can see these are elevated pustules filled with liquid, while on the torso you could see the older pox viruses which have begun to crust over. And again, this was the first virus that was completely eradicated thanks to vaccination and thanks to Edward Jenner, the originator of the pox vaccine, the smallpox vaccine. The vaccine used a single drop of Vaccinavirus punctured into the skin with a double-pronged needle. Here you can see that double-pronged needle that had been pre-dipped into the Vaccinavirus. Here is the telltale sign that the vaccine is working. It's a formation of a large scab-like crust that developed over 3 to 4 weeks, eventually falling off, leaving behind a permanent scar. And military personnel are still vaccinated to this day in the case of weaponized smallpox. And here are some other pox virus diseases. These are hosted by various mammalian groups. So for instance, cowpox, rabbit pox, mouse pox, elephant pox. Humans are actually susceptible to monkeypox and cowpox. Monkeypox in humans results in skin pox, fever, and swollen lymph nodes, while cowpox in humans is pretty rare and usually confined to the hands, other cutaneous sites that can be involved as well. And with the cowpox, if you're milking the cow, this is how milkmaids used to get the cowpox lesions on their hands. And that was the whole origination of Edward Jenner's vaccine back in the day, because he noticed that these milkmaids weren't coming down with actual smallpox. So he kind of put 2 and 2 together and said that maybe these milkmaids, by forming cowpox on their hands, became vaccinated to smallpox. And that's exactly how it led to the development of the smallpox vaccine, thanks to Edward Jenner. All right, and that leads us to our concept check number 1. Which of the following is not caused by poxvirus? Molluscum contagiosum, smallpox, cowpox, or chickenpox? Believe it or not, it's actually chickenpox. I think I forgot to mention Molluscum contagiosum, but let's go back to this table here. And you can see that, yes, Molluscum contagiosum is a type of pox virus that affects humans. Chickenpox, on the other hand, if you notice, according to this table, chickenpox is not a pox virus, but a herpes virus, one of the herpes virus family. So speaking of the herpes virus family, let's talk about that next. It's another enveloped double-strand DNA virus, the herpes viruses. All of these viruses show latency and cause recurrent infection. That means they cause an outbreak, then they can go dormant, right? Remember the latent phase, and then they could reoccur. These viral DNA can form episomes, which are independent pieces of the viral DNA that hang out in the nucleus, but don't integrate into the host DNA. Clinical complications of latency and recurrent infections with these herpes viruses become more severe with advanced age, cancer chemotherapy, and other conditions that compromise the immune system, such as HIV/AIDS. Here's what a typical herpes virus looks like structurally. You have the nucleocapsid core, right? The nucleocapsid, including the double-strand DNA, as well as an icosahedral or 20-sided dye structure capsid. This is also an enveloped virus with spike proteins. Do you recall that spike proteins are required for viral adsorption or attachment to host cells? And on the right, you can see an actual electron micrograph picture of herpes simplex virus. And again, I mentioned that the herpes virus is actually a family of different viruses. Here are some of the members: herpes simplex 1 and 2, or also known as HSV 1 and 2. These are the cause of fever blisters, also known as cold sores, as well as genital herpes infections, respectively. So HSV1 usually causes those fever blisters or cold sores on your mouth. HSV2 typically causes the genital herpes infections. Herpes virus 3, on the other hand, this is the one that causes chickenpox and shingles. Herpes virus 3 is Varicella-Zoster virus, or VZV. It first causes chickenpox, which then goes latent and can reemerge later on as shingles later in life, decades later. Herpes virus 4, or Epstein-Barr virus, EBV, associated with the infection of the lymphoid tissue. This is the one that causes mono, if you've ever heard of mono or mononucleosis. Herpes virus 5, this is known as Cytomegalovirus, or CMV. It infects the salivary glands and other viscera. Then there's human herpes virus 6 and 7, or HHVs. These cause roseola. Herpes virus 8, or KSHV, which is implicated in a type of cancer called Kaposi sarcoma. So let's start talking about these viruses in more detail. Humans are susceptible to two varieties of the herpes simplex virus, HSV1 and HSV2. HSV1 usually causes lesions on the oropharynx, cold sores, and fever blisters. This can often occur early in childhood. Some people have cold sores or these fever blisters, and then they resolve and then they never have them again. Some people have them every so often, like every summer. Some people have them if they go out in the sun and there's UV radiation. You know, it all depends on the person. But notice how all of these different herpes virus family members have an active phase and then a latent phase and then a recurring phase, right? And that's one feature of these herpes simplex viruses. And HSV2, remember, this is the one that causes herpes lesions on the genitalia and possibly oral lesions as well. It often occurs at ages 14 to 29, and unfortunately, it can even be spread without visible lesions as well. And how is herpes simplex virus spread? It's spread by direct exposure to secretions containing the virus. It's spread by active lesions. Though, like I mentioned earlier, genital herpes can even be transmitted in the absence of lesions. The way it works is herpes simplex virus multiplies in sensory neurons and then moves to the ganglia part of the neuron. HSV1 enters the fifth cranial nerve, while HSV2 enters the lumbosacral spinal nerve trunk ganglia, different areas in your nervous system. And what causes it to go from a latent infection to a reactivation? Recurrent infection is triggered by various stimuli: fever, UV radiation, stress, or even mechanical injury. These types of stressors can reactivate the herpes virus. Once reactivated, those newly formed viruses move and migrate to the body's surface, producing a local skin or membrane lesion. Now, herpes simplex virus 1 can result in herpes labialis, causing fever, blisters, or sores. This is the most common recurrent HSV1 infection, though it can also result in herpetic keratitis, ocular herpes, so herpes of the eyes, inflammation of the eye. Latent virus travels to the ophthalmic rather than the mandibular branch of the trigeminal nerve. An ocular herpes gives you a gritty feeling in the eye, conjunctivitis, sharp pain, and sensitivity to light. And then remember, type 2 HSV results in those genital herpes. And the signs and symptoms start with malaise, anorexia, fever, and bilateral swelling and tenderness in the groin. Clusters of sensitive vesicles form on the genitalia, perineum, and buttocks, followed by urethritis, painful urination, cervicitis, itching, vesicles then ulcerate. And then remember, at that point, after the vesicles ulcerate, they resolve and then they heal. But then the virus goes into that latent period in the ganglia, and then it can recur, right? And recurrent bouts usually are less severe than the first. They could be triggered by menstruation, stress, and concurrent bacterial infection. One thing to keep in mind is HSV1 and 2 infections are potentially fatal in neonates and fetus. So it's important for expecting mothers to have a preventative screening and delivery by C-section if an outbreak is present at the time of birth. Here you can see how this herpes infection can affect a newborn if those preventative measures are not taken. Herpes infection of HSV1 and 2 can also culminate in other ways. They can show up on the fingers. This is known as herpetic Whitlow, where HSV1 or HSV2 penetrate and break in the skin and cause a localized infection, usually on one finger. This is extremely painful and itchy. And if you are going to work in the fields of obstetrics, gynecology, dentistry, or respiratory therapy, these are the fields at most risk because you're encountering people and you're touching people. And, by touching people, that virus may spread to that finger, right? And this results in this lesion here. You can see the painful herpes infection Whitlow on a finger. So how do we diagnose for herpes simplex virus? Vesicles and exudate are typical diagnostic symptoms. You could visibly see them. And remember, exudate is fluid that leaks out of blood vessels, usually during inflammation. We can take scrapings from the base of lesions to show giant cells. The giant cells are indicative of a viral infection with herpes simplex 1 and 2. We can do other specific tests as well using fluorescent antibodies. And treatments include these antivirals listed here, but none of them cure HSV. There is no cure for HSV1, nor is there a cure for HSV2. These treatments simply slow or lessen the severity of the symptoms. They slow the replication of the virus and lessen the signs and symptoms and the course of the infection. Here you can see one of those large cells I told you about, those multinucleate giant cells. Here you can see a pap smear from a cervix. And, when they do a pap smear during your gynecological checkup, and what they're looking for are these multinucleate giant cells. You can see this is a giant pink cell with multiple nuclei inside, and that is a telltale sign of HSV. So, concept check number 3 time. Herpes simplex 1 usually causes what? Remember, it was cold sores. And herpes simplex 2 usually causes genital herpes. So I would say A is the correct answer there, right? So awesome. I think we're about at the halfway point now. Let's go ahead and take our break time with Gizmo and Wicket, see what they're up to. We'll be right back to finish off this chapter. What do you say? All right, let's move on to the next herpes virus, Varicella-Zoster virus, or VZV for short. Humans are the only natural host for this virus. It can't infect any other animals. Infection is transmitted with respiratory droplets and physical contact. This virus manifests in 2 different ways. When the primary infection, when you're first exposed to this virus, you get what's called varicella or chickenpox. In fact, I had chickenpox when I was a little kid because I was born before the vaccine was even developed for chickenpox. So I still remember being covered with these little tiny pox with these characteristic vesicles. The virus enters neurons and then remains latent. So that's what happened. I caught chickenpox when I was a kid. I remember all the little spots all over my body that were very, very, very itchy. And then they all resolved, went away. And then the virus enters your neurons and then goes into a latent state. And so I probably most assuredly have that virus in its latent state in my body right now. And unfortunately, unless I get the shingles vaccine, that virus could reemerge. It could reactivate and represent not as chickenpox this time, but as herpes zoster, which is also known as shingles. If you've ever heard of shingles, that's essentially reactivated chickenpox. Isn't that neat? And shingles usually occurs later in life, usually in your 50s, 60s. That's when you're most at risk of chickenpox getting reactivated as shingles. But it's really that Varicella-Zoster virus. And when shingles reemerges, it reemerges along dermatomes, which are pathways that follow where your neurons innervate the skin. And you see, this is what Varicella-Zoster virus, the chickenpox virus, looks like upon that first contact. This is exactly how it manifested on my body when I was a child and I caught chickenpox. You can see these are described as macular, papular, vesicular rashes. Macular being close to the eye, papular meaning raised bumps, and vesicular meaning little vesicles that form as well. Notice that it's called chickenpox because you have these little spots all over the body. Primarily restricted to the face and trunk though, but I remember having plenty on my arms as well. At this point, remember that the pox lesions will resolve, but the virus becomes latent or dormant in the dorsal ganglia of nerves that supply dermatomes of mid-thoracic nerves and the cranial nerves that supply the facial regions. So it goes to that dormant state in those particular neurons. And remember, this dormant state for this herpes virus can take decades, right? Because I caught it when I was 7 years old or something like that, maybe 6 years old. And usually It doesn't reactivate as shingles until you're well into your 50s. And what causes it to reactivate? It could be caused by stress. Once reactivated, the viruses migrate down those sensory nerves to the skin where they present as these rashes. Take a look here. This is the clinical appearance of shingles. It doesn't have to be in that region near the stomach. It could be up near your armpits. It could be down by the stomach. It could even be in the neck area. Early symptoms of shingles are acute pain in the nerve root and redness of the dermatome, followed by a vesicular papular rash on the chest and back that is usually asymmetrical and does not cross the midline of the body. I remember my brother had shingles, and it would happen right kind of on the side of the torso up here, a little bit higher than this image here. Again, it's not symmetrical, and it usually doesn't cross the midline of the body. Remember, it follows those dermatome routes of neurons underneath the skin. And one of the best ways to diagnose this infection is simply by looking at the chickenpox or from the shingles rash itself. With shingles, you can also look for multinucleate giant cells in stained smears prepared from those vesicle scrapings. Though unequivocal shingles identification is done by fluorescent antibody detection of viral antigen in skin lesions, DNA typing, or culture. What's the treatment? These are the treatments here. We have various antiviral treatments that shorten the length of the infection as well as lessen the symptoms. However, the best is the vaccine, Varivax, for chickenpox and shingles. Next, another type of herpes virus, the Cytomegalovirus or CMV group. Infection results in giant cells with nuclear and cytoplasmic inclusions. It can be transmitted in the saliva, respiratory mucus, milk, urine, semen, cervical secretions. It can be commonly latent or dormant in various tissues. Most infections are asymptomatic, though in the population, 3 groups develop a more virulent form of the disease. These happen to be fetuses, newborns, and immunodeficient adults. Here you can see infection of lung cells with CMV or cytomegalovirus, showing cellular enlargement and distortion of the nucleus by a large inclusion called the owl's eye. See, this right here is that large inclusion of the giant cell forming the owl's eye, which is a telltale sign of this CMV infection. Next, another herpes virus. This is known as Epstein-Barr virus, or EBV for short. This is the virus that causes a condition known as mononucleosis, also known as kissing disease. And it's very common, actually. By midlife, 90 to 95% of all people are infected. And that's because it's a ubiquitous virus. That means a virus that's present pretty much everywhere. It infects lymphoid tissues and salivary glands. You could spread it very easily. It transmits with direct oral contact or contamination with saliva. Let's say you share a drink with a friend, or you share a towel. Any kind of sharing where any kind of direct or salivary contact comes into play. In industrial countries like the US, college age kids are the most vulnerable, and anyone with an immune deficiency is the most susceptible to EBV. The disease that's caused by EBV is called infectious mononucleosis, which results in strep throat, high fever, cervical lymphadenopathy, and this develops after 30 to 50 days of incubation. This virus can go dormant or latent in the B cells and then reactivate, though this may be asymptomatic. Here you can see the signs of that sore throat that's produced with massive amounts of inflammation, as well as exudate. Remember that fluid that leaks out from blood vessels. This is a gray-white exudate and an inflammation of the palate. Now, what's really devastating and terrible is that EBV, some strains of EBV may result in a cancer known as Burkitt's lymphoma. It's a B cell malignancy. It usually develops in jaw and grossly swells in the cheek. And here you can see EBV tumor right there in that cheek region, as I mentioned. This cancer can be life-threatening. Now, the way we diagnose EBV is by looking at blood counts. You know how you have different types of blood cells? If you have lymphocytosis, that means you have more of these lymphocytes in the blood than usual. If you have neutropenia, that means you would have fewer neutrophils in the blood than is what's usual. And you could even look for large atypical lymphocytes as well. The presence of this of these types of numbers of counts, the presence of these types of cells and counts is indicative of the disease. You can also conduct serological assays to detect antibodies and antigen. There's even a test called the monospot test where you could look for this antibody that patients produce against the Epstein-Barr virus. And how does treatment work? Treatment is mainly directed at relief of symptoms and fever and sore throat. Though with Burkitt's lymphoma, this will require chemotherapy with anti-cancerous drugs. I hope you're noticing something. I just want to point something out to you that's important to understand if you're going to be any kind of clinical setting, and that is that antiviral drugs typically don't totally cure the patient, right? Notice how antiviral drugs, they tend to lessen symptoms, lessen the duration of the virus. However, usually it's really up to the patient. It's really up to the person to heal themselves. Your own immune system is either going to heal you or not, right? Antivirals typically don't completely cure you. They simply reduce the symptoms, reduce the length of the infection by slowing down the replication of that virus. All right, moving on to more herpes viruses, 6, 7, and 8. Let's talk about herpes virus 6, also known as human B lymphotropic virus. It's transmitted by close contact with saliva and other secretions. It's very common, and it causes roseola, an acute febrile disease in babies 2 to 12 months old, beginning with a fever, followed by faint maculopapular rash, usually self-limited. It clears on its own. Though adults can get Epstein-Barr-like symptoms, lymphadenopathy, and even hepatitis, which is a swelling of the liver. And interestingly, over 70% of persons with multiple sclerosis show signs of this infection. Here you can see what roseola looks like. This is roseola infantum in a baby. It's marked by this confluent rash all over the face, the neck, and the trunk. This viral infection is the most common febrile disease in young babies. And a febrile disease is any disease that's associated with a fever or elevated body temperature. And unfortunately, clinical studies have shown significant relationship between HHV6 and types of cancer, including Hodgkin's lymphoma, oral carcinoma, and certain T-cell leukemias as well. HHV7 is closely related to HHV6 and causes similar diseases, and HHV8 is even linked to another type of cancer called Kaposi's sarcoma. All right, concept check number 5. Varicella, which means chickenpox, and Herpes-Zoster, which means shingles, are caused by the same virus. Yeah, isn't it the same virus In fact, the virus is called Varicella-Zoster virus because it causes both varicella, chickenpox, and shingles, which is zoster. All right, moving on from the herpes viruses, let's talk about hepatitis viruses. Hepatitis refers to the inflammation of the liver and necrosis or death of the liver cells. So damage to the liver interferes with the liver's excretion of bilirubin. Normally, the liver's job is to take care of this bilirubin, which is a byproduct of broken down red blood cells. It's a yellow product. And if the liver can't excrete bilirubin properly, bilirubin starts accumulating in the blood and the tissues, and it causes jaundice. It causes a yellow tinge to the skin and the eyes. And there are several viruses that can cause hepatitis, inflammation of and damage to the liver. The DNA virus that affects humans is hepatitis B virus, or HBV, though there are a host of RNA viruses that cause hepatitis as well, including hepatitis A, C, E, and D. So let's talk about the DNA virus, the hepatitis B virus, because this chapter is all about DNA viruses. This is a Adenovirus, enveloped DNA virus. It's never been grown in tissue culture in a lab. Its genome contains both double and single-stranded DNA, interestingly, and its tropism is for the liver. You know what tropism means? It means the cell binding selectivity. Remember that different viruses have different tropism. Different viruses have different cells that they can attach to and infect. And the tropism for this particular virus is the liver. So hepatitis B virus multiplies exclusively in the liver, in those hepatocytes, and then it continuously seeds the blood with viruses. So it's chronic. This is a chronic infection. And the way it can spread is by blood. Minute amounts of blood can spread the disease. Blood products can transmit the infection, like shared needles, for instance, or sexual transmission as well. Hepatitis B also increases the risk of liver cancer, which is known as hepatocellular carcinoma. So how does it work? The virus enters a break in the skin or mucous membrane, or by injection into the bloodstream. Those viruses reach liver cells, they infect and multiply within those hepatocytes. Then they release viruses into the blood, average 7-week incubation time. Most exhibit few overt symptoms and eventually develop HBV immunity. So most can actually develop an immunity to the disease. Some patients experience malaise, fever, chills, anorexia, abdominal discomfort, and diarrhea. If the virus doesn't clear, this can result in more severe cases and severe signs and symptoms, including fever, jaundice, rash, and arthritis. And a small number of patients can even develop chronic liver disease, resulting in necrosis and psoriasis. How do we diagnose for hepatitis B? We could do serological tests, radio immunoassays, ELISA. It's important that we screen any blood that's meant for transfusion from blood donors. It's important that we screen any semen for sperm banks, organs for transplant, and routine prenatal testing for all pregnant women as well. With mild cases, we can manage by treatment of symptoms and supportive care, though with chronic infections, usually interferon is what's used to mitigate that disease. The best way, though, is to prevent it in the first place. Hepatitis B can be prevented with a vaccine, and that vaccine is recommended for high-risk individuals and encouraged for all newborns and infants. All right. Let's move on to the non-enveloped DNA viruses next. Let's start with the adenoviruses. Again, this is a non-enveloped double-strand DNA virus. 30 types are associated with human disease. Adenoviruses infect lymphoid tissue, respiratory and intestinal epithelia, and the conjunctiva of the eye. They can be spread by respiratory and ocular secretions. They cause colds. This is a common cold. When they say the common cold, adenoviruses are a big player. Pharyngitis, conjunctivitis, keratoconjunctivitis, acute hemorrhagic cystitis. Severe cases can be treated with these antivirals here. Again, remember, antivirals simply shorten the duration and the signs and symptoms. Here you can see what the adenovirus looks like with an electron microscope. This is a distinctive structure, and you can see that non-enveloped icosahedral capsid. Here you can see that irritation that's caused by adenoviral conjunctivitis. You have irritation, redness, excessive tearing, and partial closure and swelling of the eye. You can tell the difference between adenoviral conjunctivitis versus bacterial conjunctivitis because adenoviral conjunctivitis doesn't result in pus formation. However, bacterial conjunctivitis is generally accompanied by purulent discharge or pus-like discharge. Next, let's talk about papilloma and polyomaviruses. Small enveloped double-strand DNA viruses with a circularized DNA. That's kind of interesting. Remember how bacteria also have a circularized DNA? These can cause persistent infections and even tumors. You've probably heard of human papillomavirus, or HPV for short. What is a papilloma, by the way? It's a squamous epithelial growth, wart, or verruca. And there are 100 different strains of HPV. These are transmissible through direct contact or contaminated fomites. Remember, fomites are inanimate objects like doorknobs. There's an incubation period of 2 weeks to more than a year. The most common sign of this disease is called warts, right? Warts form, which can regress over time. They can even be removed by direct chemical application of podophyllin and physical removal by cauterization, freezing, or laser surgery, though these warts can reoccur. And there are 3 types of warts that are common with HPV. Common or seed warts, which are painless, elevated, rough growths on fingers. Plantar warts, which are deep, painful warts on the soles of the feet. And genital warts, which are the most common STD in the US. The morphology ranges from tiny warts, they could be flat, inconspicuous bumps, to extensive, branching, cauliflower-like masses called condylomata acuminata. So here you can see the common or seed warts on the fingers. There's also genital warts as well. And unfortunately, 14 of those HPV types or strains increase the risk for developing reproductive cancer. This is known as cervical cancer. And HPV 16 and 18 account for 70% of metastatic tumors. These are tumors that can spread throughout the body. Early detection is vital through inspection of the genitals. In females, you conduct a pap smear to screen for abnormal cervical cells. There is a very important vaccine called Gardasil 9 that can prevent these cancerous forms of the HPV virus. Here you can see the product of a pap smear from a cervix from a patient who's HPV positive. And what you're looking for are, here you can see a normal cervical cell, what a normal cervical cell should look like on the right. And then notice here we have quailocytes. Quailocytes are an abnormal cell with a marked clear space around the enlarged abnormal nucleus. So you see this nucleus is much larger than the standard nucleus of a normal cervical cell. Detection of such abnormal cells is indicative of a precancerous condition caused by HPV. And early detection is key to preventing cervical cancer and metastasis. All right, concept check number 7. A patient complains of feeling tired and achy. You notice a pale rash on the patient's chest and a yellowish skin tone. What is likely the infectious agent? Well, wouldn't that be something to do with the liver if it's a yellowish skin tone? That would be hepatitis B, that's right. And that yellowish skin tone is known as jaundice. Lastly, I just wanted to touch on the parvoviruses because they're really interesting. They are non-enveloped, but they are single-strand DNA viruses. These are small diameter viruses with small genomes, and they can infect animals. So they can cause distemper in cats, enteric disease in dogs, fatal cardiac infection in puppies, and a few cause infections in humans. For instance, B19 is the cause of erythema infectiosum or fifth disease, which causes a rash during childhood. Children may have fever and rash on the cheeks. Severe fatal anemia can result if pregnant women transmit virus to fetus. Here you can see that rash formed on the face due to that parvovirus. They call it a typical slapped face appearance because it looks like some kind of contusion has happened to the skin. You know, the skin's been slapped and so it looks rosy. And that leads to the end of chapter 24. What an interesting chapter covering the DNA viruses of medical importance. Next, we're going to touch on the RNA viruses, and then we're going to call it a semester. What do you guys think?
Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D. A Dr. D, Dr. D, Dr. D. Dr. D, Dr. D, Dr. D.